CYENS Weekly, an industry pundit podcast about the tech and innovation of the 21st century. An open discussion between industry experts to uncover how emerging technologies can help solve current societal issues.
So with us, we have Steven Stavrou today. How are you, Steven?
I'm doing well, thanks. How are you?
I'm very good. First of all, thank you very much for hosting the CYENS Podcast at the base. It's lovely being here. Why don't you go ahead and tell us a bit about yourself?
Sure, happy to. Thanks for having me on this new show. My background's a bit mixed in terms of different professions and different backgrounds, but I'll try and bring you through a story. First and foremost, I'm a social entrepreneur. The outcome of that is this, where we're sitting today, the base. So use entrepreneurship as a bridge builder. But my professional background is actually in healthcare and biotech. So have spent the better part of the last decade in that space. Started in research, doing research in mass spectrometry, neuropsychology. Then I found myself sort of bored in the lab and started to go into more entrepreneurial ventures, which brought me to do my MBA in Babson in Boston. And then I combined the two and I went into the business of healthcare essentially. So instead of going down the traditional pre-med route after doing research, I decided to go into the business. I spent the first few years helping run a digital arm of a research foundation where we led a mobile app and a website for digital health education for interventional cardiologists all around the world. And then I went into management consulting for a few years in the biotech space. Mostly working with rare diseases, rare oncologies, and a range of projects from clinical trials to digital therapeutics and so on and so forth. And most recently, I've been appointed to the European Health Parliament to be a part of the Digital Health and Governance Committee. So I'm looking forward to being part of that in the 7th session in 2022.
Wow. I mean, I don't even know where to start from the entire background. Well, why don't you tell us a bit more about your new ventures, about the European Health Parliament?
Sure. European Health Parliament operates like a parallel parliament in Europe, which brings together about 60 individuals from across the European Union in the health space to come up with policy recommendations to help address Europe's most pressing healthcare challenges, which I would consider global healthcare challenges because we face similar healthcare challenges in all continents to different degrees and scales, but there's similar issues being faced. And the session of the Parliament meets for about 6 months in the year. This year will be hybrid. It'll be both virtual, also in person in Brussels. So hopefully we'll get the chance to meet up in person in Brussels and tackle these issues. Bring our minds together to create policy recommendations that, with the hope that some of them may be implemented at the European level to address those issues. Each session has a theme. So for the 7th session, there are 6 themes. The first is digital health and governance. So as we transition to more digital-based health solutions, how do we do that and how do we govern that, especially with data? Then there's future-proofing health systems. So in a post-pandemic world, how do we proof and protect our health systems and prepare them for the future? The third, which builds off of that, is building resilient health systems. Then there's self-care and preventative health, which is big for chronic disease management. And we always say prevention is the best medicine. So how do we prevent certain diseases or prevent the spread of certain infections? And the last one is the care of healthcare workers. Basically, as healthcare workers get overburdened, especially in a pandemic and post-pandemic world, and there's a huge supply and demand gap between the demand for healthcare and the supply of healthcare workers to service that, we need to make sure we protect and prepare our healthcare workers for the present and for the future. So we'll be working on those thematic areas over the course of the next 6 months.
Okay. What will you say? You mentioned that you're going to view what the top challenges are. Can you tell us what those are, either in Europe or in Cyprus or worldwide?
Definitely, yeah. A lot of the healthcare challenges that Cyprus is facing is probably aligns quite well with the rest of Europe and the rest of the world. As I mentioned at the beginning, the scale of these challenges varies. When we're talking about accessible healthcare and sort of the cost of healthcare, we might see differences. Of course, the cost of your healthcare is still high across the board, But in the US, where the system is very privatized, it's probably a lot higher, whereas in Europe, which is moving more towards universal healthcare, such as what we've seen here in Cyprus with YESI and the national healthcare system, it's becoming more accessible and affordable. But for Cyprus and in Europe in general, there's a few challenges we face going forward now and in the next few years. The first being that we can't discuss any healthcare challenge without first mentioning the climate crisis, because the climate crisis is a health crisis. Climate change and global warming and pollution all create serious health issues, both burden to the system and to patients. So that's what we need to address first and foremost. The second is accessibility to healthcare. So how do we get healthcare delivered to people and areas that need it the most and who can't access it as easily? So in the context of Cyprus, this would be an older demographic, older population. It would be delivering healthcare in rural areas, so places hard to reach in villages, and to low-income communities who can't afford private healthcare. And a national health system like YESI, despite the challenges it's still facing, helps increase that accessibility. That directly relates to the cost of healthcare as well. Another challenge we are facing right now here in Cyprus and in Europe is the lack of healthcare workers. There's a severe shortage, and we've seen that at some of the public hospitals here as well, but that's being faced across Europe and other parts of the world as well, especially in Asia, where I don't know the stat from the top of my head, but it's very alarming. It's something like one healthcare worker, physician, and nurse for I don't know how many people. It's a very alarming stat. And of course, managing infectious disease now, which is top of mind from the pandemic. Not just pandemics, but how do we effectively manage epidemics, as they sort of locally spread? And all of these things that I've discussed and brought up, there are digital solutions that can help solve them, and those are opportunity areas, not just for governments and policymakers, but also for entrepreneurs. The last one that's not too talked about, but that was heightened during the course of the pandemic, is bias in medicine. So we'll see a lot more as a challenge. We'll see people talking a lot more about gender bias in medicine and treatment, and also racial bias in medicine and treatment, because different races and different genders feel pain and experience disease differently. And right now, through the treatment of disease and in clinical trials, we're not seeing those populations fully represented. So that'll be another thing we'll have to face in the next few years.
Sounds very interesting. You mentioned that digital health is already helping tackle all these challenges. Can you give us some examples?
Yeah, definitely. Telemedicine is the obvious one right up front, telehealth. I wouldn't consider it the most advanced form of digital health because it's been around for quite a few years, and it doesn't require that much advanced technology from what we're used to, video conferencing, data protection, so on and so forth. But because the pandemic made it difficult for us to do face-to-face consultations, it paved the path for telehealth to be more adoptable globally. The problem is that health systems are still catching up with being able to support it. So while we use data health to improve access to healthcare in rural populations, because now they don't have to venture out to find healthcare or a hospital or a practice, they can get consultations remotely through video chat or through chat. Do they have the technology? Do those rural populations have the technology to access that? Do our health systems have the infrastructure to support telehealth? So these are questions we're going to have to answer, and policy can help change that. So telehealth is a big one. Virtual reality, which seems to be sort of overspoken about these days, but in the context of digital health education, it can open amazing doors for what's out there for education. I used to attend a lot of cardiology conferences around the world, and there used to be gamers that would come, and they've developed these VR applications for physicians. And physicians are a little more old school, not all, but most of them. And they might walk past something like this, but we were excited about it, and we demoed it. You basically get into this virtual reality arena, and all of a sudden you're in the middle of a heart, and you're able to navigate through the chambers. And if it's someone with a disease, they can sort of replicate the disease in this virtual world. And we can see inside the heart how to treat it. So for physician education, this is an amazing tool. But for patient education, it's an amazing tool too, because we tend to treat patients as if they don't know anything scientific, but they're actually much more informed than we think they are. And if we empower them with more information, they can better treat themselves too. And it improves their mental health as well. So VR for patient and healthcare provider education is also a big tool. And then, of course, AI and blockchain. We're seeing AI being used a lot for drug discovery and development. So how do we quickly, more cost-effectively, and more accurately develop molecules and drugs to address rare diseases or existing conditions? How do we use AI to help physicians prescribe the right medicine to the right people to lower adverse events, which puts less pressure on healthcare systems because there's less cost in the end, and people don't stay in the hospital for a long time because they're not coming back because they have adverse events to their medication. And of course, blockchain for digital health records. We're actually seeing it here in Cyprus. There's a blockchain called VChain. The Mediterranean Hospital is the first to implement it, and it's essentially giving patients a digital passport for their healthcare. It's decreasing waiting times. It's helping securely transfer and store and connect sensitive health information. So an amazing application that we've seen. So these are some examples of how digital technologies are helping address some of our most pressing healthcare challenges.
Do you think, in your opinion, can you see Cyprus either implementing what you've already mentioned, or how do you think that Cyprus could become amongst the leaders of the healthcare innovation ecosystem of Europe?
Yeah, definitely. Cyprus can absolutely be a healthcare or health tech hub, not just because of its strategic location where we can take knowledge and exchange resources from 3 different continents, Europe, Africa, and Middle East Asia, but because we have amazing research here, research that, if it's medical research or medical technology research, can be commercialized and put out there to the rest of the world. And we're slowly becoming a hub for innovation in this region as well. And we should embed health innovation within that, because we do have the local resources to do so. Also, because we're a smaller island, we could be a little more agile with what we test and what we pilot, whereas bigger nations would have to go through a lot more red tape in order to get healthcare innovation out there. But I would suggest doing more to promote healthcare innovation in Cyprus. We don't see it as much as we do clean tech, social entrepreneurship, and other things that we're becoming known for as our entrepreneurial brand here on the island. Would love to see health be at the forefront. I know there is a pre-accelerator launching with JA Cyprus that's focusing on health, which is great. It's a great first step, and we hope to see more activities come out. But strong policy to support that will be needed. And so we hope to see more of that in the future.
What would you like to see happening in the near future, in, like, let's say no more than 5 years from now?
Yeah, I would like to see more digital health startups being launched here or starting here, especially in the digital therapeutic space. Something I forgot to mention in your previous question that's super important. We're able now to create digital medicine, and it doesn't matter where you're located to do that. If we have entrepreneurs here working remotely through tech, we can also do digital therapeutics. And so these are digital products that also work on medicine. An example of this is Achille in Boston, startup out of Boston, who got FDA approval for a video game that treats ADHD. The prescription is literally a link to an app. And so there's amazing use of digital therapeutics in medicine right now. And would love to see more infrastructure to support that kind of innovation here in Cyprus. So Pre-Accelerator is a great start. Any sort of incubator to help health tech startups at the university level, where there's great research to happen in parallel to help them accelerate. It could be in the universities, which would be a great first step. Yeah.
Well, unfortunately, this is all the time we have for this podcast, but definitely would like to hear more about it and see a lot of the things that you've mentioned be implemented. Thank you so much for your time, Steven, and thank you for being with us today.
Thanks for having me. It was a pleasure.
This podcast is brought to you by CYENS, former RISE, the Research Centre of Excellence in Cyprus, focusing on interactive media, smart systems and emerging technologies. For more information, please check our website on cyens.org.cy.